Hello, my name is Dominic Santana, and I'll be walking you through my presentation on atrial fibrillation. What is atrial fibrillation, also known as A-Fib? A-Fib is defined as a rapid and irregular contraction in the muscle fibers of the atria caused by abnormal electrical impulses that disturb the heart's rhythm. These irregular contractions, or arrhythmias, make the upper and lower chambers of the heart beat out of sync with one another and create turbulent and uneven blood flow that may lead to the development of a blood clot or thrombus, which can cause a stroke if left untreated. What are some of the risk factors of AFib? Conditions such as obesity, diabetes, and high blood pressure, also known as hypertension, make patients more likely to develop AFib. Other causes may include myocardial infarction, which is a heart attack, sleep apnea, atherosclerosis, and sick sinus syndrome. Advanced age also puts people at an increased risk. The prevalence of AFib is higher than expected, and the condition is expected to triple by the year 2050. Currently, 9% of Americans over the age of 65 are affected by AFib, and the number of cases grows to 22% for those over the age of 80. AFib primarily affects those of white European descent, with men at a slightly greater risk than women. A patient should consult their doctor if they experience signs or symptoms such as palpitations, which is a fluttering or pounding heartbeat, dyspnea, angia, which is chest pain or discomfort, asthenia, or fainting, also known as syncope. These symptoms may become more frequent or worsen with physical activity or increased exertion. When diagnosed with AFib, patients fall into one of four categories. Paroxysmal, where the symptoms resolve on their own. Persistent, where the symptoms last for more than a week. Long-standing, where the symptoms continue for more than a year. And permanent, where the symptoms cannot be reset and must be controlled by medications prescribed by a doctor. AFib can be confirmed by your cardiologist after a few diagnostic tests, which can include a physical examination where they may perform auscultation to listen to your heart and lungs, monitoring your heart's pulse, and confirm your family medical history. Cardiovascular technicians may also perform a variety of diagnostic procedures, like an EKG to monitor your heart's electrical activity, an electrocardiogram to view your heart structures, or perform blood tests. The cardiologist also may prescribe medications such as beta blockers, antiarrhythmics, or anticoagulants in order to regulate a patient's heart rate or thin the blood to prevent blood clots. These medications will likely be paired with lifestyle change recommendations in order to mitigate the condition. For more severe cases of AFib, surgical procedures may be necessary. These procedures can include electrical cardioversion, which restores the normal heart rhythms, implanting a pacemaker to correct irregular heart rates, destroying arrhythmogenic heart tissues via a catheter ablation, or preventing blood clots with a procedure called a left atrial appendage closure, where a small sac in the left atria is sealed off. Wrapping up, it's important to reiterate that AFib is an already very prevalent and potentially life-threatening condition that is only expected to become more commonplace worldwide. Recognizing the signs of AFib and consulting a doctor for personalized care plan and healthy lifestyle choices can help improve or even save lives of those living with this condition. Thank you for listening to my presentation. If you would like to research A-Fib further, I have a list of references and resources on the next slide.